A local woman wants to emphasize the importance of funding cancer research as the Trump administration proposes closing the Division of Cancer Prevention and cutting $18 billion from the National Institutes of Health.
Michelle Herron shows us how she's trying to make a difference.
Darlene Smith was enjoying life as a wife and mother of 3 girls when she was diagnosed with HER2-positive breast cancer.
I had to make some decisions whether to fight it, what lengths that I wanted to go to get better, and I decided to do everything I possibly could to be able to see my 3 girls get married and the grandchildren that they would one day have.
Darlene underwent chemotherapy, radiation, and surgery, but it was a new drug in a clinical trial that gave her hope.
I was able to research and find a drug that was in clinical trial for stage 4 patients. And there was controversy whether I was stage 3B or stage 4. I lobbied for it and I got it off clinical trial, and I'm still here today.
20 years later, and Darlene is doing great. She now works with others who are walking a similar path and volunteers with the American Cancer Society's Cancer Action Network to help make sure everyone has access to the latest treatments available.
We've came a long way, but we've got a long way to go. We want the best drugs that we can with the least side effects so that people can live to see their children get married and their grandchildren be born.
But Maddie Michael with the American Cancer Society Cancer Action Network says proposed cuts to cancer research funding could hurt that. The Trump administration wants to close the Division of Cancer Prevention and Control and cut $18 billion from the National Institute of Health.
In Tennessee alone, we have 300 grants right now through the National Cancer Institutes. Just looking at, new discoveries, new treatments.
Billboards like this one have popped up in Chattanooga, Alabama, and Louisiana, calling on the public to tell Congress not to cut funding for cancer research.
It's really important that Congress, who has the final say on the budget, gets the message that Tennesseans are at risk.
Proof that hope is the heartbeat for the will to keep going.
When I was diagnosed, I could not find anyone alive that had a similar diagnosis as to what I had at that time. So now I think God's left me here so that I can be that person for other people.
If you would like to get involved, you can text CURES to 73508 with this week's Making a Difference. I'm Michelle Herron.